a lot of magic, the effects are what they are, but it's the performer who really brings the magic to you. My name is Stephen P. Wood, an associate clinical professor here at Northeastern University, and I teach a class here on magic and healthcare. I grew up in a small town in New Hampshire. My parents were both educators, so I always have enjoyed education. But, I said I want to study magic, and, in this small rural town in New Hampshire, where are you going to find that? But my mom found the Society of Young Magicians. I've also known for probably several decades that I wanted to work in some part of the medical field. I actually started out as a paramedic, then became a nurse, and then a nurse practitioner. I think a lot of people are pretty skeptical when you say, we're going to teach you some magic tricks and it's going to help you better understand concepts of patient care or managing patients. I got to see a lot of growth in the way they perceived a lot of things like, biases, or how they thought about their approach to describing a procedure that they might want to be doing, how to better use body language, and how to make patients comfortable around them and have them trust them, not through trickery, but through just using these principles. Most of my magic shows now are either for dementia patients, and so I'll go to a dementia unit and do magic with that group. And I also do another show for people with neurodegenerative diseases, primarily ALS. And what was amazing to me was that one of the people who had pretty severe dementia actually remembered some of the effects that I was doing. That really interested me in, does magic, does wonder and surprise stimulate, some of the learning centers of the brain? And so that's an area that I think, has a lot of potential. With the people with neurodegenerative disease, I do a lot of magic tricks where it's tactile. They get to hold things, they get to squeeze them, they get to feel the textures, things appear or disappear right in their hands. And I just can see a lot of joy. And I think there is also an opportunity there for, can these magic tricks, be helpful in their recovery? Could this be used in physical therapy or occupational therapy? Because there are a lot of hand movements and things of that nature that could have a therapeutic effect. As a magician, you need to build trust. You need to have people want to see what you're doing. They want to believe what you're doing. And I think using those principles of magic and carrying them over into medicine has been a good principle for me.